let the stakeholders in. Oh. Good morning. Welcome to the Public Health and Minority Health Disparities Subcommittee. I'm Committee Chair Delegate Heather Bagnall. It is February the 6th, and we are having our first work session on legislation.
Okay, sounds great. Thank you so much.
I do understand that some of our members are having some technical difficulties, so we are considering 4 bills today. They are House Bill 358, House Bill 42, House Bill 127, and House Bill 39 in that order. House Bill 189 has been taken off the agenda. The stakeholders just needed a little more time. They're working on that bill right now. So we're going to start with House Bill 358, Prince George's County Work Group on Health and Wellness. Aaron, if you can walk us through the bill, and I believe there is an amendment that was offered at the bill hearing.
Yes, this is a local bill. It establishes a work group on health and wellness in Prince George's County. There was an amendment that was offered at the bill hearing that adds the director of Prince George's County Department of Parks and Rec to the work group.
Thank you very much. We did also receive a letter from the county executive, Angela Alsobrooks, in support of this bill. If I could have a motion on the amendment.
Move favorable on the amendment.
Can I have a second?
Second.
All right, it's been moved and seconded. Any discussion? All right, all in favor say aye.
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 Any opposed? All right, on the bill as amended.
Move favorable on the bill as amended. Second.
All right, it's been moved and seconded. Any discussion? All right, all in favor say aye.
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 Aye. Any opposed? Go ahead and raise your hand. All right, thank you very much. House Bill 358 has been voted favorable unanimously. Thank you, everyone. We're going to move to House Bill 42. This was a departmental bill, public health services and protections revisions. There are no amendments, no fiscal note, and Aaron, if you can walk us through the bill.
Yes, this bill aligns state law with federal law prohibiting the sale of tobacco products to all individuals younger than 21. It authorizes MDH to reallocate projected unspent funds awarded to a county for cancer prevention, education, screening, and treatment programs to another county. It shifts responsibility for the cost of emergency medical treatment for an abused or neglected child from MDH to the Governor's Office of Crime Prevention and Policy. It repeals the requirement that the Secretary of Health appoint or convene an expert panel on child abuse and neglect. It alters requirements related to the State Council on Child Abuse and Neglect, and it requires a reporting requirement regarding cigarette restitution fund, counter marketing, and media efforts.
Thank you very much, Aaron. If I can have a motion on the bill.
I actually have a question.
Let's go ahead and move the bill, and then we'll open it up for discussion.
Move the bill.
Second. All right, and Delegate Alston.
Hi. Okay, so Aaron, could you say again what's being moved to the Governor's Office of Crime Control and Prevention?
It is its responsibility for the cost of the medical treatment that's been provided for an abused or neglected child. And apparently they are already doing this, so it is mirroring current practice.
Okay, so it's just them paying for it, not them actually doing it.
Yes.
Okay, all right, great. That's what I wasn't clear on. Thank you.
Delegate Rosenberg.
Does this have any effect on the priority or the allocation of funding policy-wise under the cigarette restitution fund? To your knowledge?
I know the department's here and they talked about it at the bill hearing. I think all it does is if the county has not, they know each year, mid-year, whether the county is going to spend all their CRF funds. And if they're not going to, they can shift those allocated funds to another county to use those funds.
Does that answer your question, Delegate, or would you like to hear from the department?
Let's hear from the department just to hear what they say. I'm fine with the council's response, but yeah.
Delegate, this is Dr. Leslie, I'm Deputy Secretary of Public Health.
So just to echo what Aaron said, we provide allocations to each of the counties at the beginning of the year, and then around the mid-year mark, we take stock of where they are in their spend rates, and we typically have a few counties which we know are not on track to spend those dollars. And then there are some counties that are clearly going to spend their full amount and are asking for more. And so this would allow us to, at that midway mark, transfer funds from counties that aren't going to be able to spend it to those that can, but it doesn't change the total amount of dollars.
Thank you very much. Does that answer your question, Delegate? All right, Delegate Chisholm.
Thank you, Madam Chair. And can I assume that these counties that aren't going to hit their mark, that aren't spending it, are a willing participant to send it to other counties? And how often does that happen, that we have counties that aren't spending their allotted amount and transferring to another county?
Dr. Kalyana.
So I'll take the first part of that. So what typically happens right now is that those counties that don't spend it, those dollars just remain unspent at the end of the year and revert to the CRF fund. So, you know, to your question about willing participant, they just don't spend the dollars. So this is just an attempt to actually spend those dollars that would otherwise just go unspent. In terms of the number, I'm going to turn it over to Dr. Crom to talk a little bit about the details of how often this happens.
Sure. Thank you very much. My name is Elizabeth Crom, and I'm the director of the Prevention and Health Promotion Administration here. So I can probably count on one hand the number of counties where we would have wanted to make this change in the past. As you know, the cancer burden is different based on jurisdiction. So this would give us the flexibility if we do have more individuals who need services in one county where another county's funds would go unspent, to be able to move that over to serve the needs of those residents.
Okay. And just a technical question. There were some amendments in here from the Maryland Department of Health. Are they being adopted? Are they going in the bill?
I know they were addressed at the bill hearing by MDH, feeling that they weren't necessary. They had talked to the governor's office, and that office's name is going to be changed anyway. So we're kind of just leaving that name alone for now until the executive order is adopted, changing the name of the office.
Okay. Thank you, Madam Chair.
Thank you, Delegate. And just to clarify for my own edification, this is when you're talking about the reallocation, that's on a yearly basis, correct? That's just the drawdown for that year. So you can do an evaluation at the mid-year point. Is that correct?
That is correct. There is no carryover effect. It is for that fiscal year.
Thank you very much. Seeing no other questions, we have the bill has been moved and seconded. All in favor, say aye.
Aye.
Any opposition? Go ahead and raise your hand. All right, the bill passes unanimously. Thank you very much, and thank you to the department for being here to answer all of our questions, and great questions to all of our members. We're going to go ahead and move to House Bill 127. This is the Public Health Non-Occupational Post-Exposure Prophylaxis, the NPEP Standing Order Program Establishment. I believe that MedChi and the department were working on amendments. So Aaron, go ahead and walk us through the bill and where we are, and then we'll hear from the department on those MedChi on where we are in those discussions.
Okay, this is also a departmental bill. It establishes the Non-Occupational Post-Exposure Prophylaxis NPEP Standing Order Program. The program must authorize a licensed pharmacist to prescribe and dispense NPEP under specified circumstances, and a licensed healthcare provider to dispense NPEP and delegate the dispensing of NPEP to an employee or volunteer of a private or public entity under a written agreement. The department MDH will be administering the program, collecting fees, establishing guidelines for conducting patient education and training, and collecting and reporting data on the program.
Thank you very much, Aaron. And I know we have Aaliyah Horton here from the pharmacists. We have Pam Casemeyer from MedChi. We have the department. Who would like to be heard on this bill?
If I could start, if that's okay with our colleagues that we've been working with. Sarah Case Herron, Director of Governmental Affairs for the Maryland Department of Health. We are currently working on a set of amendments that takes into account both well, essentially all of the concerns from the folks on this call. I think we're very close, but we don't yet have the written amendments ready for the subcommittee yet. So we hope to have those very shortly, but we want to make sure that our draft can be socialized with everyone and looked at.
No, we appreciate that. And I think this subcommittee is comfortable with giving you more time. But I just want to hear from the stakeholders as to what the concerns are, and that way, when we see the amendments, we'll know that they've been addressed. Is that sound reasonable? Aaliyah Horton, I see you have unmuted, so go ahead.
Oh, sure. Yes. So we, Pam and I met with Department of Health folks yesterday to go over a number of them. Primarily, it was just clarification on oh my gosh. I'm going to be honest, I don't have my notes today because I thought we were moving it to next week. But yeah, if you want to go through them, but I will say I feel comfortable with the conversation that we had, and I think the progress is moving well. So I'll turn it back over to Ms. Case.
Thank you very much.
Yeah.
I was just saying, I think that the biggest clarification had to do with some concerns around pharmacist dispensing or delegating dispensing authority. So the amendments would pull back that delegation piece, which I believe both sides, there were some concerns on. And then the other amendments involve I'm going to not use the acronym, the Sexual Assault Reimbursement Units program, for which provides NPEP at no cost to sexual assault survivors. So that was one of the other pieces, and then a clarification regarding which CDC guidance would be controlling at a given time. So those were kind of the big amendments in substance, and Pam or Aaliyah can weigh in if I've missed anything, but I think those were the big ones.
Thank you very much. And Pam Casemeyer, I know you're here as well.
Yeah, I don't really have anything to add other than kudos to the department. And oh yeah, we had a really good conversation. I think we worked through some things, but we want to get the language right and not spend a lot of your time if we've all kind of figured out what we need to do, have it ready to go amongst all of us when we bring it back to the subcommittee.
Thank you so much. Are there any, while we have the stakeholders here, are there any questions from the members? All right, seeing none, we're going to hold this bill. We'll bring it back next week, and it sounds like we should have consensus amendments by then. So we are going to turn to the last bill of the day, which is House Bill 39. That is Residential Service Agencies Reimbursement, Personal Assistance Services, Home Care Worker Rights Act of 2024. This bill we saw last year. It has not been amended. There's no fiscal note. And Erin, if you can go ahead and walk us through the bill.
This bill specifies that the Maryland Department of Health may reimburse a residential service agency for personal assistance services through Medicaid only if the services are provided by an individual who is classified as an employee.
Thank you very much. As a reminder to our members, this bill did pass the House last year, not unanimously, and did stall in the Senate. And Delegate Lewis, I just want to confirm that the bill is in the same posture as it passed the House last year. Is that correct?
Thank you, Madam Chair. Yes, this bill is in the same posture as it was passed out of this subcommittee and HGO last year.
All right, thank you very much. If I can have a motion on the bill.
Move the bill.
Can I have a second?
Second.
All right, it's been moved and seconded. Any discussion? Delegate Chisholm.
Thank you, Madam Chair. I'm just going to reiterate what I said in committee. I've never seen a workforce increase by creating more restrictions, and that's what this does. And I did speak to a lot of, look, these people do great work, and I understand that, but they also want some flexibility in how they're classified. And I would hate to pass a law like this or pass a bill like this that ends up driving more people out of the industry in an industry that's trying to attract more people. And I think anybody that is an RSA or an RSA employee or a 1099 has the option to go either or, because there's a tremendous need for these people. So I just wanted to put that on public record, that I think that this bill has the potential of driving some good people out of the state of Maryland that do this work right now.
And I appreciate that, Delegate Chisholm. Just to confirm, because I think we have stakeholders on here, this bill would codify the guidelines of the state guidelines and the federal guidelines. Is that correct? Do we have someone on the call?
Hi, Madam Chair. I'm happy to take that one if you'd like. And thank you, and great to see everyone. That's correct. There is a guidance document jointly authored by the Office of the Attorney General, the Maryland Department of Health, and the Maryland Department of Labor that makes crystal clear that these workers are employees, regardless of what anyone calls them. It also aligns Maryland with existing federal law. There's been a recent independent contractor rule under the Fair Labor Standards Act, which is also quite clear on the point. So it's just aligning Maryland practice with Maryland law and federal law.
Thank you very much, Mr. Rodwin. Delegate Hutchinson.
Thank you, Madam Chair. I also concur with Delegate Chisholm as well. I spoke to a few of my local home health providers in my county this past weekend, and I just don't see this as a bill that is going to provide more access to care or more providers, and I just wanted to go on record as that as well. Thank you.
Thank you very much, Delegate Hutchinson. The bill has been moved and seconded. So we will go ahead and take the vote. All in favor, say aye. Anyone opposed, go ahead and raise your hand in the chat so that we can make sure that we have the record clear. And I have opposed Delegate Chisholm, Delegate Hutchinson. So the bill passes not unanimously.
Delegate Bagnall, could you just tell me the number in favor?
Yes. 2, 3, 4, 5, 6, 7, 8.
Okay, thank you.
Did I count myself?
I'm neutral.
6. Oh, you're abstaining?
Yes.
Okay, 7. Thank you for the clarification, Delegate Hill. Is that everything you needed, Aaron? All right.
Yes, thank you.
Well, thank you, everyone. That actually concludes our work for today. I think we all have our marching orders for next week, and we will have more bills to hear. So thank you all very much. I understand there were some technical issues getting into the meeting today. So I appreciate everyone making the effort to get here and so that we could get quorum and get going. And I'm going to give you back a half an hour of your day. So thank you very much. And we will see you in committee at 1 o'clock.
Do we need a motion to adjourn, Madam Chair?
That would be great if we could have a motion to adjourn. Thank you.
Move to adjourn.
Second.
All right, moved and seconded. All in favor? Aye.
Aye.
Get out of here and go enjoy your lunch, and we'll see you at 1 o'clock.